creates an interstate compact to try and draw out a cure for those chronic diseases that many of our people in our state suffer from, whether that's diabetes or Alzheimer's or cancer. And so what we're trying to do is figure out a way to incentivize companies or individuals who may have a cure for these diseases to bring them to market. Because what we hear so many times are those stories that there are cures out there.
In those stories we hear that people with those cures can't or won't bring them to market because it is too costly to finalize clinical trials, or there are no incentives, or the drug companies are keeping those cures from being produced out of fear of losing profits on maintenance drugs.
If we are really compassionate about people, then we should do all that we can to see if those stories are true.
Now, I can't verify if any of those stories are true, but we do know that there is research that points to positive results for potential cures to some of these diseases.
For this to be considered a cure, the treatment must be no longer than 1 year to show that it is a viable cure. And once that is established, then the compact will take control of any patents or anything that is out there pertaining to this cure and then pay out that prize money. There is no cost to the state until a cure is found, and then once that cure is found, the cost is actually the savings that the state has when not having to pay medical coverage for those diseases. So there is no real impact of the budgets of the states under this plan. Our focus has been on the families of Kentucky and how can we make Kentucky a better place to live and raise a family. For the entire General Assembly, I think it shows that that's where we are, that we love and we care for people, and we're going to do everything we can to make their life better.